This review article is entitled Contribution of C3G and other GEFs to liver cancer development and progression. As you can see here, upon chronic liver damage induced by hepatitis virus or alcohol, it can induce liver fibrosis that can progress to liver cirrhosis, leading finally to liver cancer. Most frequently, hepatocellular carcinoma, HCC, and sometimes cholangiocarcinoma, CCA. Several genetic and epigenetic alterations are involved in inducing liver cancer and metastasis. It should be mentioned Ras and Rho GTPases, Ras GEF such as C3G, and Rho GEF such as Tiam1 and 2 that are becoming relevant in the last year. In this table, we summarize some of the Ras and Rho GEFs whose expression is altered in liver cancer and that have a function in this type of cancer. For example, among the Ras GEF, it should be mentioned C2G, and among Rho GEFs, Tiam1, 2, or BAP2 and 3. C2G CRKL SH3 domain binding one nucleotide releasing factor is a GEF for different Ras proteins, mainly RAP1. However, it can add to GEF-independent mechanisms through interaction with different proteins such as CRKL or P130Cas. It regulates several cellular functions such as proliferation, differentiation, addition, and migration, and many more. We have recently found that C3G levels increase in HCC, contributing to tumor growth. However, for inducing lung metastasis, their level decrease, and then in the metastasis, they are increased again. In HCC patients, high levels of C3G have been detected, and in addition, some genetic alteration. And this is associated to a lower survival of these patients. Also, RAP2A and RAP1 levels are increased in HCC patients and are associated to lower survival. However, in CCA, it is unclear what C3G and RAP do. CRKL is a protein that interacts with C3G. There are different isoforms, and it is important to mention CRKL. CRKL levels are increased in HCC patients and contribute to decreased survival of these patients. CRKL is then regulated by different microRNAs, so this mechanism fails in HCC, leading to proliferation, migration, and invasion of HCC cells. In CCA, high CRK and CRKL levels have been also detected, as well as some genetic alterations. And finally, several Rho GEFs are increased in HCC. For example, Tiam1 and 2S are GEF 9 or 19, EPT2 or BAP2 and 3. Some of them are then regulated by several microRNAs, and this mechanism fails in HCC, so leading to proliferation, migration, and invasion of HCC cells. In addition, LBC is involved in resistance to doxorubicin, and Tiam2S and RGEF, known among others, promote epithelial mesenchymal transition. Concerning CCA, high levels of Tiam1 have been correlated with malignancies. Therefore, some of these Ras and Rho GEFs are becoming very important in liver cancer, and new studies are required in the future, especially to characterize their function in HCC.